Hello everyone, welcome to today's session. Today we'll talk on the topic soft skill in patient handling. It is one of the important topic for all the healthcare professional who is working in the hospital. In this video, we'll explore how the communication, empathy, teamwork and emotional intelligence directly impact the patient care and safety. Whether you are a medical technologist or a nurse or a doctor, hospital staff, mastering about the soft skill is not only the advantage in your field, it will be a professional necessity. Every day we are dealing with the patient. If you know about the soft skill, it will be make your journey smooth and easy. These skills will help to build trust, reduce patient anxiety, and improve the collaboration within the healthcare system. In healthcare, a wide range of skills are required to ensure that the professional provide high quality care, work effectively in teams, and handle complex medical and administrative tasks. These skills are typically categorized into two main types, that is, hard skill and soft skill. First, we will know about hard skill. Hard skill in healthcare refers to the technical and professional ability the worker will learn through the formal education, or it may be during the training program or the practical experience. These skills are specific to the healthcare field, and it will be directly related to the patient care and the laboratory or the clinical work. These skills can be easily measurable and it can also be testable, meaning they can be assessed how much the person is having through exams, or it may be through some certifications, practical demonstration, or performance evaluation. Hard skills are essential for safety and accurately performing the medical procedure, diagnostic test, and clinical tasks. Example for this hard skill are performing laboratory tests, operating medical equipment, collecting and handling the patient sample, interpreting the lab reports or diagnostic reports, following some of the clinical protocols and safety guidelines. In short, hard skill will ensure the accuracy, safety, and quality in the healthcare services. It is very crucial for effective patient care. As said, these are some of the example for hard skill: physical examination, medical procedures, surgical skill, emergency care, anesthesia administration. These are some of the example for hard skill. It will mainly depend on the training the person is having, the knowledge the person is having, and also the education he or she has gained. Next one will be related to the soft skill. Soft skill in the healthcare are also called as interpersonal skill or communication skill. So these are the emotional ability that will help the healthcare professional to interact effectively with the patients, families and the co-workers. Unlike the hard skill, this soft skill will mainly focuses on how care is delivered. It's not just about what is done. These skills are essential for building the trust, showing the empathy, improving the teamwork, and ensuring the patient satisfaction. So, if the person is very strong in the soft skill, it will help in professionalism, and it will also help the healthcare professional to handle any of the stressful situation, communicate clearly, and to provide compassionate and patient centered care. Some example here for soft skill are effective communication, active listening, empathy, emotional intelligence, teamwork, collaboration, professionalism, and ethical behavior. This soft skill is a cluster of skill that will influence how we interact with one another. It's all about the ability to relate and connect with the people. Some importance of this soft skill are to handle the interpersonal relations, to take appropriate decision, to communicate effectively, and to have good impression and impact to gain professional development. Most important soft skill that we need to have while we are working in any healthcare are communication skill, body language, making decision, self motivation, leadership, teamwork, creativity, problem solving, time management, and ability to work under pressure. First one will be related to the communication skill. We all know communication is meant for exchanging the information. When it comes to healthcare setting, this communication is one of the most important soft skill. It will mainly refers to how the healthcare professional will share the information or whether how they will listen actively to the patient queries and respond appropriately to the patient's families and the team members. Good communication will help in understanding the patient problem, and it will also helps in explaining the procedure clearly and to reduce the fear and anxiety of the patient. Using simple language instead of medical terms, it will ensure the patient's understanding also and their condition and about their treatment. Effective communication will also improve the teamwork among the healthcare staff, reduces the error, enhances the patient safety and satisfaction. Both verbal communication, that means speaking clearly, and non-verbal communication, eye contact, facial expression, body posture, it will all play a vital role. Top communication skill that we need to have while we are working in the healthcare are active listening, communication method, friendliness, confidence, sharing the feedback, volume and clarity, empathy, respect, and responsiveness. There are two modes of communication: real time communication and virtual communication. Real time communication is a type of communication where sender and receiver interact immediately at the same time. Some example for this real time communications are verbal communication, non-verbal communication, and written communication. Verbal communication is a face-to-face conversation, or it may be the classroom teaching or patient interaction. Non-verbal communication is all about the facial expression, gestures, eye contact, or the body language. Written communication in real time refers to the writing on the board during the class or the notes written and explained instantly. Advantages of this real-time communications are mainly immediate feedback we can get and better understanding, it will be helpful, and emotions and expressions are clearly conveyed here and very effective in teaching, counseling the patients and in the patient's care as well. Virtual communication happens when the people communicate using the technology, and it may or may not be instant. Example for this are mainly the telephone calls, cell phone communication, email, voice messages, chats, blogs, online platforms, etc. Advantages are it can be communicate from anywhere, and it also saves time and the travel time. Useful for distance learning and professional communication as well. Some limitations are there for this virtual communications. They are uh, the possibility of the misunderstanding is there, and requires internet or the network connectivity. Body language is a form of non-verbal communications only, so it supports the verbal communication and often it will makes the message more effective and believable. It includes the facial expressions, eye contact, gesture, posture, movement that conveys our thoughts and emotions that without using the words. The face is considered as the index of the mind because it clearly reflects the person's interest or the attention, emotions, or the attitude the person is having. Example: a smiling face usually shows the friendliness or the approval, or raised elbow can show the surprise or the curiosity. Even without speaking, the face communicates what is happening in the mind. It supports the uh, l- verbal communications only. Example: the nodding the one's head, it will indicates the agreement or understanding or the encouragement. Maintaining the eye contact, it will show the confidence and attractiveness, or the crossed arms may indicate the discomfort or the lack of interest. Importance of the body languages are mainly to keep people's attention, to create a good atmosphere, and to create more impactful message. In the workplace, the way we sit reflects our attitude, confidence, and professionalism. In soft skill, the posture play an important role in creating the positive impression. Always when we are in a workplace, so sit upright with a straight back, keep the shoulder relaxed, head should be erect and facing forward, and feet should be flat on the floor, and hands can rest on the lap or the table. Maintain the appropriate eye contact. So, what it shows is mainly the confidence and attractiveness. A student or employee sitting upright during the class or meeting shows the professionalism and readiness to learn. So, what we should not do is the slouching or the bending forward or leaning back too much on the chair or crossing the leg excessively, or shaking the leg, resting head on hand or desk, or sitting with the arms folded tightly. So, these all things we should avoid while we are in a healthcare field or any of the working place. This picture shows us how we are supposed to stand. So the middle one is the good posture. We can see the balanced upright posture is a good way to stand. Here again we can see the good posture to sit. In the first image we can see the lady is leaning back too much on the chair. So this is also not shows the professionalism. While we are sitting also we have to be uh, sit upright with a straight back, and our shoulders should be relaxed, and we have to maintain a constant or the appropriate eye contact should be there. Again, here also the same thing. The straight or the upright position should be there while sitting. So, what matters are how we stand, how we move, how we appear to the people, how you look to the people or look at the people, how we sound. All these things will impact on our professionalism. Always when we are walking we have to avoid the nervous movement. Don't walk up and down. So when we are uh, going also we should not go front and back, so that is not showing the professionalism. Keep your hands down except for the gestures, and we should not keep our hands in the pocket also, and we should not cross our hands while standing. We have to keep our hand relaxed, and it should be down only. Don't fidget, scratch, jiggle while we are standing or sitting. When we appear in front of the people, we have to always greet them with a smile on the face. We have to say good morning, sir or madam. We have to say good morning, good afternoon, or good evening. So it will make their day as well as our day as well. So we have to always look energetic, relaxed, and confident. Decision making is one of the important quality or the skill that will mainly helps in analyzing a situation, evaluate the option, and choose the best action in timely and responsible manner. In laboratory, the professional will face the situation where quick and the correct decisions are very much essential. In that case, the decision making will helps in ensuring the patient safety, accuracy of the test, quality control, and proper workflow. Self motivation is also another important skill that we need to have. It is the ability to encourage oneself to work effectively, efficiently, and consistently without the external pressure. It helps an individual to stay focused, positive, and committed to the goals. Benefits of this self motivations are mainly it will improves the performance and productivity, builds the confidence and professionalism, encourages the lifelong learning, and reduces the stress and burnout. Some example for this are rechecking the test result for accuracy without being told, or learning new techniques or instrument independently, completing the task on time even during the busy shift, and maintaining the cleanliness and safety standards regularly. Leadership is nothing but the ability to guide, motivate, and support others to achieve the common goal while maintaining professionalism and responsibility. Qualities of a good leader is the confidence and clarity, good communication skill, decision making ability, responsibility and accountability, respect for the team members. Some benefits of the leadership skills are mainly it will improve the teamwork and efficiency, builds the trust and respect, enhances the patient safety, encourages a positive work environment. These are some of the benefits we can say. Leadership is not limited to the managers and supervisors. Uh, all the professionals, all the healthcare or the laboratory professionals need to show the leadership in day to day work. Teamwork is the ability of an individual to work together cooperatively to achieve a common goal with mutual respect and responsibility. Some examples for teamwork are sharing duties during busy shift, assisting the colleagues in sample processing, coordinating with the doctors and nurses, supporting the juniors and trainees, and communicating clearly during the shift changes. So, in healthcare and laboratory setting, the work cannot be done alone. Effective teamwork will ensure the quality of the result. It will ensure the accuracy, efficiency, and the patient safety as well. Here in the team, T refers together, E refers to everyone, A is achieves, and M is more. Together, everyone achieves more. Creativity and problem solving skill, it is a highly valued because they are hard to develop by an individual. Creativity is the ability to think new and in an innovative way. Problem solving is the ability to identify issue, analyze the cause and find effective solution for the same. In healthcare and laboratory setting, both these skills will work together to handle daily challenges very effectively. Laboratories are often subjected to unexpected such situations such as equipment issues, sample problem, or time constraints. Creativity and problem solving skills will help the professional to respond calmly and effectively for all these problems. Some example for the creativity are finding alternative method when reagents are temporarily unavailable or managing the workload when there is a high sample load, identifying the cause of abnormal and inconsistent result. These all are related to the problem solving and the creativity of an individual. Time management is the ability to plan, organize, and to use the time effectively to complete some of the tasks in the laboratory very effectively and meet deadlines. Proper time management ensures the timely reports, smooth workflow, and quality patient care. Good time management will help to process the sample without any delay and prioritize emergency and routine tests, and it will avoid the work overload and stress.